Okay, thanks.
Don't you sell in each of those?
You can order a few and then send the invoice in and see.
Mm-hmm.
Can you hear me there?
Yeah.
Yeah, she could hear you. I just don't know how you can hear them, but
no, we can't. Yeah, so basically, you know, third-party insurance is always different in terms of coverage. So there's Sun Life, Manulife, Blue Cross, all that type of thing. And then, you know, everybody's sort of coverage is a little bit different. So I think what Steve's suggesting is sometimes with a prescription from a physician and then possibly a letter to try to support the need for use, whether it's Magic Bullet or other things that aren't typically covered, sometimes with a prescription and then a support letter is what is needed, and often things are approved with those types of things in place.
Okay.
And a couple comments there. One from Roger, who said yes through Sun Life. Recently, they wanted a breakdown of ingredients, also get them custom made. And then Karen said her company has with a doctor note attached to invoice. So.
Unfortunately, every single one of the extended health have different black book what they work off of. So it's all a trial and error. The prescription and the letter is good, but if they say they don't pay for Magic Bullets, a prescription and a letter may help fight your case, but it also might be a rejection right there and then.
Right.
I don't know if I answered it or.
I guess that would be the first step, is if they're saying no, then to get a prescription and a support letter. If they still say no, they can try to appeal it. After that, it's kind of there's no coverage.
Okay.
Okay, Lynn says okay. Let's see if there's any. Leslie, how about you? Do you have any immediate questions?
A couple.
Mm-hmm.
One is, did anyone else hear the interviews on the Current on the 3rd of April about UTIs? It was pretty exciting, actually, the approach that the researchers are taking now. And that is available as a podcast or a transcription.
Okay.
So,
Leslie was making a comment. I don't know. Did you guys probably didn't hear it?
We don't hear anything.
Okay.
Except for you.
Except for me. Okay. So let me see if I can change this here. Hold on.
I just sent it as a question now.
Okay. Hold on.
Or a comment, I mean. Comments?
Can you hear Leslie now if I hold the phone up to her? Leslie, go ahead.
Okay, I've just sent this as a comment. Did you hear me?
Okay, yes.
Yep. She said, did anyone else hear the interviews on the Current of April 3rd on UTIs, new research, which is exciting. It is available as a podcast or transcribed. Most people are saying no, or they didn't, and asking you what is new or interesting.
Well, one interesting thing is that the lab reports don't give doctors useful information. That was a bit stunning to me. Persistent infections are not our technique. That was a relief. It's because the bacteria have burrowed into the wall of the bladder and they've gone kind of dormant or inactive. And they don't really know what triggers them to act up again, but they will every so often. And there's kind of emphasis on using either what one researcher called very simple, elderly, narrow spectrum first generation antibiotics. And the other researcher was much more inclined to have people use anything but antibiotics. It's quite a different approach. Yeah.
Can I ask you a question, Leslie?
Okay, one second, Steve. Hold on. Oh, okay. Hopefully Leslie can hear you. You might have to talk really loud, Steve.
Where can we get a copy of or look up this podcast? Do you have a URL or?
CBC, cbc.ca, the current.
Can you write it down, Terry? Because I can barely hear.
Yep. All right. CBC, like the TV, and
It was on radio.
Yeah, current on the radio. Something like that, but probably not that link that I'm typing, everybody. I will send it to you, Steve.
Oh.
And Bonnie as well. Yeah, I will.
Oh, actually, Roger's already put it in.
Everything about the urinary tract, infection news. I'm not quite sure. What I have to say about it is, if someone has an indwelling catheter, if someone is doing intermittent catheters, it is more than highly possible that they have bacteria that lives in their bladder. Normally, urine, that environment is sterile, but when you're introducing catheters or you have a Foley catheter in, there's bacteria that lives there. It's there. And yes, sometimes that bacteria gets busy and it causes an infection. The recommendation is that if there's bacteria that shows up in the urine, there has to be more than just bacteria in your urine to be taking antibiotics. So if somebody takes a specimen of your urine and it's showing it's showing bacteria, that is not the reason to be treated for a UTI. And a lot of docs will treat for a UTI based on just bacteria alone. But the recommendation from the spine experts is that you do not treat based on just bacteria.
Right. I hope everybody heard that. Do not treat. Let's see if I can crank the volume up here. Just based on bacteria, and Roger got us the podcast direct link there, so I will send that to you guys.
Okay, great, thank you.
And Leslie and Marnie said unless you have a full-blown fever, you should not take antibiotics, was the last she heard. Yeah, I think Pam also said I treat based on her symptoms. Hold on. And I kind of do the same thing. I treat based on my symptoms as well, but sometimes it could be just like, I don't usually get a fever. I usually have, like peeing myself more regularly, or pain or whatever. So
everybody has different other symptoms,
right,
that might come about. So,
yeah,
increased spasticity, increased leaking. If it's just sort of cloudy, smelly urine, you might be able to catch that in the bud by just drinking a lot more water and try to keep it at bay. But if you start to have those flu-like symptoms or things like that in the urine, then that's more advanced signs of symptoms where you probably do need to take an antibiotic. But many, many times, if it's just bacteria and kind of cloudy, smelly urine, you may be able to catch it yourself by just drinking more water.
Yay, and now we have you online.
Oh, wow.
Do you mind taking this up a little?
We have you online.
Terry, no?
Yes.
Okay.
So
I'm not Steve.
Ha,
There you are now. Oh,
Uh-oh.
you're okay. You're okay. You're okay. Can you hear me?
you can. Sorry, we tried 3 different computers here at the hospital, and finally we found one that worked.
Get in closer.
Awesome. Yeah.
Oh, he's going to get a cup of tea, water.
So, and Janine unfortunately said that info came to her too late. Now she's resistant to oral antibiotics. So I guess that is what the end result could be, you know, if you're taking antibiotics all the time, right?
Well, yeah, I mean, the more you take antibiotics, the more resistant. So it's just about being very vigilant about you know, having specimens taken, having them taken correctly, and then having, you know, making sure that if somebody's trying to write you a prescription for an antibiotic, that are they writing the right prescription? Do they actually already have the results back? A lot of times people are getting prescriptions that are called broad spectrum antibiotics that cover, you know, a range of bacteria, negative or positive bacteria. And it's really encouraged to make sure you get the results back, know what antibiotics are you know, they're going to fight the bugs that you do have, and not just take a broad spectrum antibiotic before you even get the results back. And that quite often is what has happened in the past. And I think it's just through educating you is to make sure that you don't have a doctor just writing you a broad spectrum antibiotic before getting results back.
Mm-hmm. Thank you. Leslie also wanted to ask if the white cell count is an indicator to prescribe, the leukocyte count.
Well, I mean, certainly they look at counts for sure. Sometimes they'll look at, you know, sometimes there's more than one bacteria. You know, if there's kind of 3 or more of that bacteria, that might be a red flag that you need to retake that specimen because, you know, it may be a contaminated specimen, right?
I'm going to talk out of church here. I think everybody on the line should be in control of their own results. If you're not online with myehealth.ca, I would become familiar with that, and whenever you bring in a result, 2.5 days later after you bring in the result, it will have what bug is in what is causing you to bring in a sample. So 2.5 days later, you could go to your GP and request the correct antibiotic instead of having the GP guess at what antibiotic. So the more you're in control, the better off you are. Anyway, that's my 2 cents.
Does that make sense to everybody? You can register online for myeHealth.
Yeah.
You can look up your own results from a specimen that's taken, and it will say what the bacteria is sensitive to and what it's resistant to. And making sure that you're taking an antibiotic that is sensitive to that bacteria, right, and not resistant. And making sure that your specimens are taken correctly. If you have an indwelling catheter, you want to get a clean specimen. So You don't ever want to take a specimen from a leg bag. You don't ever want to take a specimen from an existing indwelling catheter. It's better to change the catheter and get the clean specimen directly from the bladder. That is what is best practice.
Yep.
I had another thought. It might come to me.
Okay. You guys your screen is a little bit frozen right
Got
now.
it.
We can still hear you.
Everybody look frozen.
You can, yeah, you're okay now. Yeah. So we have a few little other things here from Lynn. Hold on one second though. Someone is having problems. I'm trying to multitask here. Sorry, I'm not very good at it. Someone's having problems.
Terry, maybe I'll just while you're working on something.
No. Can you see the chat box there? Anyways, there's an option that says chat, and people are writing their questions in there. But Lynn has another question. She has a Mitrophanol, and her urine samples will have mucus in it due to bladder augmentation. The results say contaminated, so she gets no answer. Any suggestions?
Well, I think, Lynn, probably you need to go with other symptoms, right? Is knowing kind of what your other symptoms are, whether you do get fever or, you know, just that unwell flu-like sort of symptoms. You're right, there's a lot of mucus in the urine with Mitrophanol because they use part of the bowel to form the Mitrophanol, making the bladder bigger. There's mucus in bowel tissue. It's supposed to be there. So when they augment and use bowel tissue for the Mitrophanol, it will still continue to produce mucus. So do you irrigate your Mitrophanol at all? No? So I would talk to your urologist is that something you ever did to help with the mucus production, irrigating the Mitrophanol?
In the first year.
Yeah.
Can I speak up again?
Yeah.
I've also Lynn had an augmentation, and the mucus in the bladder, it's terrible. I mean, they told me it was going to be 3 months, 6 months max. It's almost been 15, 20 years now, and it's still there. So, but if I have an infection and I take a result in, I still get a result of what bug is in the bladder, even though there's mucus. So if you're bringing a sample in and you've got a bug, it will show up.
Right. Maybe it's small town hospital. They just say contaminated and they won't grow it.
But do you have a Life Labs there?
Yes, I usually use the hospital one though, because Life Labs isn't open on weekends.
Right. Yeah.
Yeah.
And whenever you get an infection, it's Friday night.
Yeah.
Yeah, for sure.
You can't look, and then you can't look up your results because of it being a hospital authority.
Right.
If you had Life Labs, you'd be able to take over that control and have a look yourself.
Right.
You
So
you might consider on a Wednesday.
Okay.
You guys are frozen again. Uh-oh. They froze up.
They bringing a sample into Life Labs and just get them during the week.
Right.
Sorry.
Okay.
Go ahead, Lynn.
My requisition form, I have had typed on it that I've had the surgery and I have mucus in my bladder and that they're to try and grow it anyways. But so maybe I'll try that with Life Labs instead of the hospital and I'll get better results.
And with Life Labs as well, you can have your GP write a year referral.
Mm-hmm.
So really every day you could bring in a sample. I mean, you wouldn't want to, or you wouldn't have time to, but you can get to know your bladder.
Right.
If you're feeling bad, you can bring a sample in and you think you got a UTI, but it could be your bowels. It could be hemorrhoids. It could be. It's not always the bladder. So the more you rely on my eHealth, the better off I think you are.
Okay, thanks.
I mean, probably about 80% of bacteria that's found in the bladder is E. coli. E. coli is not normal in the bladder, but it is normal in the bowel. So if you are finding that a lot of the bacteria that you're getting is E. coli, then maybe you want to review your bowel routine, right? And just to see what's going on with your bowel routine. Are your bowels loose? Is there contamination happening during bowel routine? Things like that.
And I don't know if everyone on the call has heard about demonose, which is it only works
with E. coli.
With E. coli. So again, that's why it's important to know what bug you have in your bladder.
Yeah. So if you're taking D-mannose as a is that D-mannose?
Yeah.
Good job, Lynn.
So
Chairstuff does that.
You do?
Yeah. So a lot of people.
Yeah.
Okay.
Yeah. So a lot of people take D-mannose as a preventative measure for fighting UTIs. It's not going to treat a current UTI, but if you want to try to prevent them, D-mannose is something that a lot of people will take. So D-mannose changes the structure of the bacteria, and the bacteria grow these little appendages that hopefully will hang on to the D-mannose and then just be flushed out. So it prevents the E. coli bacteria from attaching to the bladder wall.
And it is a natural sugar, so if you do drink coffee, which everybody knows is not great for you, you can put it in your coffee and it's a sugar, or your tea, or on your cereal in the morning. There's lots of different ways to take it.
Yeah. So again, it's a trial and error type of, vitamin kind of deal. So it's not going to hurt you to try it. I mean, obviously there's an expense to having that as well. And you buy it over the counter. It's not a prescription. So again, that's money out of your pocket. But I think if you're trying any of those things, you got to really try them for 3 or 4 months before you really decide if they're beneficial or not for you. They work for some people, and some people say they don't. So I know a lot of clients will take D-mannose on a daily basis, and others won't take it until they feel something brewing. They just take more of it when they feel like they're getting an infection.
Thanks. All right, Angie wanted to say something. Angie, I'm going to unmute you and you can ask your question.
Sure, thanks, Terry. My question is, do you have any recommendations on how to reduce sediment from the bladder? Because it's been a major problem for me in terms of clogging catheter and then, having the AD and all that.
I drink more water.
Apart from that,
How much water do you drink, Angie?
I drink a lot of water, a lot.
Yeah. Some people just have more sediment than others, and if you've got some pouching in the bladder, I don't know. Talking to the urologist about what your bladder looks like. Sometimes there's pouching of the bladder, and urine kind of can sit in those pouches and not drain. And if those mineral deposits that start to collect, then they start to kind of form stones, or you'll see that sediment more. Sometimes even with position changes, some people will see sediment more when they're sitting upright, or they'll see sediment more in the bag when they're laying down.
And so sometimes even those position changes affects how their bladder drains. So yeah, I mean, the drinking more water, but you know, we really want all that sediment not to sort of form stones, right? So I don't know if help with looking at diet changes, if any of that kind of thing, if you've tried that. Vitamin C, a lot of people will try to keep their urine more acidic.
Angie, have
no,
you
I haven't tried the vitamin C. Bonnie, when you were speaking, I didn't quite hear. Were you saying pouches?
The pouching of the bladder. So that would be something your urologist would see when he did your cystoscopy, right?
Oh, okay. Well, he's never mentioned it, but I can ask next time. Sorry, Steve, I interrupted.
That's okay. That's okay. Have you tried the cranberry juice over years?
I tried it years ago, but I never really noticed any difference.
When you tried it years ago, sorry, when you tried it years ago, was it the sugary cranberry juice, or was it pure cranberry juice?
I was taking the tablets.
If the tablets work for some again, but you've got to take them quite often.
Yeah.
You almost have to take them every couple hours.
A tablet every couple of hours?
With the tablets, that's a lot of people say that they're taking them on a 6-8 times a day.
Oh wow.
If you try the cranberry juice again, try the stuff that tastes terrible. Try a pure cranberry.
Okay.
Because if it's sugar, and you've got an irritant in your bladder, it will create more of a problem. And then the whole pocket thing, if you can be as active as you possibly can, it gets it moves everything. It's like a waterfall. If there's a stagnant spot, you're in trouble. But if it keeps flowing, and that's why they say drink, drink, drink. But they also should say drink, 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 and be active.
Okay.
I mean, we all know that, right? It's hard, Angie. It's hard. Yeah.
Yeah, just
that's my 2 cents.
It just feels like that's the bane of my existence, right? It's one of the things about SCI that's just hard to deal with. But yeah, okay. Well, I'll give the cranberry another thought, and maybe the vitamin C, and see what my urologist says next time. Thank you.
You see see the urologist once a year, Angie?
Yeah, I have a cysto once a year. Yeah.
Okay.
Kim wanted to make a comment on that. She just said, everyone says drink more water, which is so true. If you do intermittent casts and want to go out in the real world, wheelchair washrooms are not always available. So she restricts her drinking. Drink is easier said than done. Yeah, and sometimes it is. I restrict my drinking in the nighttime, right? So I don't have to get up in the middle of the night. But I do intermittent catheters too, and I know that you guys talk about that also in the GF education sessions. It's different if you have an indwelling or a Foley versus intermittent cath. So
absolutely. I mean, I think the drink thing it's probably a lot easier if you have an indwelling catheter. If you're doing in and out catheter, that's a challenge. I mean, I'll restrict my fluid too if I know that there's not going to be a bathroom nearby. But I think if you're consistently most of the time trying to drink, a fair amount sort of throughout the day, and then like Terry said, you limit it a bit maybe in the evening so you can get a longer duration between your intermittent catheters. What you drink, certainly. I mean, anything with caffeine, alcohol, those are drinks that are going to make your kidneys busy and produce urine. You know, it's hard to avoid having a coffee or two a day, or, you know, having a drink once in a while, but you have to know that those will make your kidneys produce more urine, and you may have to do an extra catheter if you are having those types of beverages, right? So I think it's just knowing that, you know, it's better to have little sips throughout the day and not go all day and then go, oh my God, I haven't even had anything to drink today, because that happens. And then you don't want to be guzzling a liter of water because you haven't had anything to drink all day, because that's just going to throw your bladder management off.
Yeah. Thank you. And then next is Roger. Roger, are you there? Not sure. We don't hear you, Roger.
I'm here.
You're there. Did you want to ask your question?
I was just wondering, for the false readings on lab results, how soon after you've already done a run of antibiotics can you do another test and get accurate results?
Yeah, that's a good question. I mean, you want to make sure that you have got a specimen in before you take. So for some people who are told to start taking an antibiotic, you at least need to get the specimen taken and into a lab before you start taking antibiotics. But how soon after? You know, I would think that a week after you're finished an antibiotic, you could do another specimen.
Okay.
If you wanted to repeat to see if the bacteria is gone, or if your urinary tract infection. Plus, you should be feeling better as well, because you know you're not going off of just bacteria in the urine is always going to be there, right? If you're doing catheters, so you should be feeling better in other ways. The urine should be clear, less concentrated. You know, you should be feeling better as well.
Okay.
That's a great question, Roger. I have asked that to Life Labs, and they say 2 or 3 days after. But as long as you tell us what antibiotic, and you tell us that it was 2 or 3 days ago that you were on that antibiotic. I've never seen a research study on it. The urologist has never answered it. That was a Life Labs person that answered that question.
Great, thanks.
And I have heard up to about a week is kind of a safe zone to repeat a culture and sensitivity to test for bacteria. So if you've given it a good week after you have completed your course of antibiotics, then that should give you a fairly true result.
Thanks.
Thanks, Roger. Next on the list, we have Dave. Dave.
That's me.
Yeah. You want to ask your question?
Sure do. I got a couple of things, actually. So I picked up an infection after a cystoscopy, like almost right away, in January, and I've had recurring infections since then. Like I'll go on antibiotics, and 2 days later, I start having symptoms again, or sometimes it's 5 days, 3 days. But so I just finished another round of antibiotics last night. So we're looking at doing a sphincterotomy, Tupper. And initially we were looking at a suprapubic, but that suddenly his mind changed about that. So I got a few questions around that. Just your opinion on the pros and cons of those two, sphincterotomy versus suprapubic, in terms of reducing residual and hopefully thereby reducing the frequency of infection. Second question about getting second opinions. how does one go about that, and how do you know who you're seeing would have a different perspective? Like I thought maybe I should try to get a referral to somebody that's a professor in urology or something that may have a broader sort of view of the picture about what's going on with the bladder. But a lot of times urologists aren't necessarily, they don't specialize in spinal cord injury. So so I just don't want to waste people's time by getting a referral to somebody that may not, sort of know much about the situation.
Can I ask a couple questions before Bonnie takes over? Your urologist you're seeing at ICORD right now?
Yeah.
So there is a fantastic urologist out in Richmond, Dr. Rappaport, who sees everybody, including spine.
Right.
If you were after a second opinion, I would highly recommend him. Do you know what bug it is, Dave?
I know it's not E. coli, but I don't remember the exact.
And is it the same bug that's showing up every time?
Yes.
And are you doing the proper antibiotic?
Well, I generally have been taking Cipro, but we've tried a few other ones, and some didn't work. The Cipro, I'm not symptomatic right now. I generally haven't felt that bad other than before I went on this particular course. I had old school symptoms, the clamminess, the sweating, the headache, the nausea, all sorts of things. I hadn't felt like that since probably 5 years into my injury, which was a long time ago. So that, just sort of looking at, it's you hear opinions from different people that have had these things. Some people swear by the suprapubic. Other people, I find more people are frustrated by the sphincterotomy. They have to have them over and over. They get a lot of bleeding and other issues that occur. And
just one more comment, and then I had a really good customer the other day that did a round of Cipro, and the bug was there 2 days later.
Yeah.
And I preached about my e-health and knowing what bug it is, and the knowing what antibiotics to take. And it turned out when he did that, Cipro was resistant. So you can take Cipro the rest of your life, and it's going to affect your bowels, and you're going to feel terrible, but it's not going to kill the bug. So again, that my e-health is
yeah, I'm signed up for that. I'm just waiting I just did that recently, but I haven't got the passcode yet.
Right.
So they said they were going to send, but I went over that with my doctor, and we looked at what the bug was, and there was Cipro and one other antibiotic came up. I'm running out of, seems there aren't as many antibiotics that are going to work on the bug that I've got anymore. But there was only 2 that came up that would be useful for this particular bug. Other than they talk about moving into this other class of antibiotics, sort of super antibiotics. Not exactly sure what they are, but I think it's the last resort kind of antibiotic. I don't know if you know about, I'm sure you know about them. I'm just not really clear what, if one moves into that category, what does that mean?
Yeah, it just, it's worrisome in that, if you become more and more resistant to different classes of antibiotics. I think, Steve's point is really good that you actually, take the responsibility of looking at your own results, seeing what antibiotics are sensitive to the bug you have, and make sure that you are on one of those, because more often than not, antibiotics are prescribed and they're resistant to the bug you have. So you want to make sure if you're on an antibiotic that it's the right one to fight that bug. You want to always make sure that you finish your prescribed time of antibiotics. So 7 days, 10 days, you absolutely finish them. You can get your urine tested a week later to see, if the bacterial load is down and if you're feeling better. In terms of a second opinion, everybody's entitled to one. And yeah, I would go to a separate sort of clinic where you can see a urologist that is separate from my court, if that's where you've been going. So the suggestion is a good one, because all you're doing is gathering information so that you can make a more informed decision, and you have every right to do that, right? So sphincterotomy, again, like, you know, really everybody's very different how they respond to sphincterotomy, based on your, you know, the urodynamics you've had, the cystoscopy that you've had, and what the results are, because everybody's bladder looks a little bit different. And so in terms of, you know, how successful it would be for you, you know, it might be 60 or 70% successful. And yes, you're right, a lot of people have to have a sphincterotomy repeated, right? So so that's just opening up the bladder neck more so that your urine can flow better through condom drainage, or but, you know, again, suprapubic catheter is an indwelling catheter. It comes with equipment and maintenance and sometimes problems as well. But, you know, I think the more you talk to other people that have a suprapubic catheter, or people that have had sphincterotomies, aren't as common as they used to be, Dave. But, you know, if you come to a point where you've got outlet obstruction and you're just not flowing as well through condom drainage, then, you know, those are kind of your two options to go with, right? So I think you know what's involved with both, and I think getting a second opinion to help you make the decision is a really good idea.
Cool.
Terry, do you mind if we hear Roger? I'm interested in what Roger's comment there was to Dave's question.
Dave, I'm going to put you on mute again, just so you know, and unmute Roger. Hold on, where's Roger? I'll find, I got a whole list of people here. Roger, I'm muting you.
Oh, hi. Can you hear me?
Yep.
Yeah, Dave, I consider you one of the survivors like me. You've been around for a long time. We went through a lot of the same stuff. And one of my urologists suggested that I talk to an infectious disease specialist, which I did. I always track, you know, my infections. I do know my bladder. You know, I use my eHealth since it started. But we're having some big challenges. And of course, in the old days, we all had sphincterotomies on a regular basis. But in any case, I went to the infectious disease specialist, and they analyzed everything I've been doing for the last 25 or so years. And she came up with some recommendations around bladder management, which has worked. I'm still dealing with some of the infections, but my residuals are down. You know, it's been a whole different ball game. We looked at the suprapubic, we looked at all the different approaches. I'm still on condom catheters. We haven't done intermittent catheterization or anything like that. And it's been working. So I would suggest if you're looking for a second opinion, besides just the urologist, you might consider talking to someone who specializes in infectious diseases.
And where do you go about seeing an infectious disease person?
Well, my urologist just referred me to one, you know.
There's an infectious disease.
I can't hear her.
At the Diamond Center on the 3rd floor. There's a number. Oh, sorry. Yeah, there's a number of infectious disease docs at the Diamond Center, and they also see patients in their private practice as well. Dr. Ted Steiner is one of them, who's very good, and
well, you guys are frozen again. I don't know if you can hear me. Dave, I have you on mute now too, by the way. You and Roger. Oh, now you're back. You're back. So we kind of missed a lot of that, but Dave, did you want to pick up from where Bonnie, when you heard Bonnie leave?
Yeah, what else did I want to ask? I think one was about, you were talking about alcohol and coffee and various things that are not good. But do you know much about red tea? Like, are teas that don't have caffeine in them or anything decaffeinated better than, like, is it the caffeine that's the problem or is it something else?
Yeah, caffeine is a diuretic, so it stimulates the kidneys to produce urine. So, you know, your body doesn't get to take advantage of what you're drinking because it all just gets peed out, right? So Steve will tell you he's a big non-caffeine tea drinker.
I hate water, drinking water. So I drink probably 4 cups in the morning and 4 in the afternoon and 3 in the evening. But I do intermittent, and I get up 3 times at night to do a catheter. So you don't want to follow my routine at night.
Now, sometime when you were telling me about your routine before, I was quite surprised how many times you do that in a day, because I know we were looking at with Dr. Nigro, was the idea was we started doing intermittent, but it became a real management problem, and I was still getting infections even though we were using sterile technique, and we did the training and everything. So that's why we're looking at these other surgical options, which, I mean, I've never had a sphincterotomy. I'm still on condom drainage. I was scheduled to have one a few times, like 40 years ago, but it never happened. So yeah. I've been lucky in many ways. Yeah.
I mean, intermittent catheters are the best practice, but you've got to also have a life, right? If it takes half an hour to do a catheter, you're not going to have a life.
Yeah.
Yeah, you have to wait.
If you can do them independently versus if you have to have people do it for you, then you've got to have people around. It becomes a bit difficult if you've got an active life, so outside of the home. But
so your decision making has to come. You know, you have to consider all of that. You know, funding, equipment, caregiver time, all of those things have. You know, in and outs are practice, but that doesn't mean that's what's going to work best for you based on your day-to-day life. So you kind of have to look at all those things to make your decision. So yeah. Well,
unfortunately I have to go. I've got a rehearsal I have to go to, but I just wanted to thank you for your time. It's good to see you again. And Steve, thanks for the delivery this morning. Yeah.
Thanks, Dave.
Take care.
All right. Take care, everybody. Bye-bye.
I know there's like a bunch of stuff coming in here, so I just wanted to give more people an opportunity to talk. So I'm just gonna, Tom, where are you, Tom?
Hi, Tom. Tom Parker.
Yeah, Tom, do you have something you'd like to say there?
Yeah, I think so. Can you hear me?
We can.
Cranberry juice. We buy it in the frozen concentrate, and I think it has a bit less sugar than the jug that's ready mixed. And the advantage of the concentrate is I can make it as strong or as weak as I want. And I can add it to my hot water, which turns into like a red tea that somebody was asking about.
Okay.
But it's been quite beneficial. Starting the day with a 6 or 8 ounce glass of that seems to be really, really beneficial. And occasionally, Steve tossing in the D-Manos, maybe once every 2 or 3 months. But doing the intermittents, I'm able to manage myself to do that. But again, restricting fluid when you're out somewhere where you can't easily access the toilets can be a problem. But in that case, if one can drink a good citrus drink, that seems to help as well. But just food for thought. And luckily, I did get many, many years ago a urologist recommending a sphincterotomy. And I decided against it because he described it as minor. And when I talked to another doctor, it sounded much more than minor. And probably would have prevented me from ever using intermittent catheters, which I use now. So I'm glad I didn't select the sphincterotomy.
Mhm.
Earlier, sorry?
Sorry. No, go ahead, Tom.
No, go ahead. I was going to change the topic.
They're done less. We know more, and they are done less and less. And I'm sure they're done less and less for a reason, right?
Mhm.
So, I mean, it is an option for men for bladder management, but I think that you have to weigh all the pros and cons about doing it.
Yep.
And with the cranberry, I mean, I think you've been in spinal cord injury for a long time, so it's all about trial and error, and what works for you might not work for somebody else. But I think that you just keep on coming up with things, and you found something that works for you. Making it warm, I mean, all that's good because it can help trigger your bowels in the morning, or there's lots of benefits to doing what you're doing, right?
Touch wood, I have been very lucky. Earlier, somebody mentioned the UTI research and that some of the older interventions were now being considered. And I think back to when David's father, Dr. Symington at GF Strong, was using an alternation of an acidic bladder and then something to make it a basic environment. And I think it was a product called mendelamine or something. And recently I heard from somewhere, I can't tell which of my SCI friends was chatting about it, but there seems to be a suggestion that something like that could become more functional for us too. Have you heard anything about that, Bonnie?
I haven't.
There are still some old timers, Tom, that are using the melamine. But I can't comment on it. I don't know if there's any sort of research out there. I've never personally used it.
I'm not about to try it because it wasn't very pleasant the first time around.
Mm-hmm. I'll ask some of the urology nurses that question and provide that info to Terry that she can share it, right?
I see there's a lot of questions about the suprapubic. What I can say about the suprapubic is that it's a great option if you're thinking of switching to something, because it can be taken out real easy. You can go back to what you were doing. Currently, it's not a huge invasive operation, and it's literally you pull the suprapubic out, and I don't know how long you have to wait, Bonnie, but
the hole that they form to put the suprapubic in, it varies with everyone. I had a fellow, it didn't close for almost a month. Some people, that hole will close over within a week. Now, having said that, the longer you have an indwelling catheter, the smaller the bladder gets, because when you have an indwelling catheter, the urine is draining all the time. So that bladder capacity, it diminishes the longer you have an indwelling. I just had a fellow, though, that had an indwelling for 3 years, and he had a Foley for 1 year and a suprapubic for 2 years. And he has just transitioned to do in and outs. He was getting tons and tons and tons of infections with his suprapubic, and so he's now doing in and out catheters, and it took a while. He had to start with doing them every 3 hours. He was taking a medication to help calm the bladder so he could hold a little bit more, but overall he's switched over very nicely, and he's very happy with is management now. So again, suprapubic, you got to drink lots of fluids. You got to have your yearly follow-up, and making sure that you're getting the urologist to check your bladder. In the long time in indwelling catheters can lead to bladder stones and bladder cancer. So that again is why urology follow-up once a year is super important. When you have an indwelling especially, and if you're doing in and outs.
But personally, I would never recommend one, but if you've exhausted, like I know UTIs, I get UTIs all the time, that's why I drink so much, but if you've exhausted everything, it is an option that can be reversed.
Yeah.
The augmentation, the sphincter, a sling, they're tougher things to reverse.
Yeah, and again, you know, not everybody is a candidate for a suprapubic catheter, right? Especially if they don't have a very competent tight sphincter, because then they might have urine leakage through the urethra anyway. So you really need to see your urologist to decide if that's even something that is possible for you to do. Like you need to look at your anatomy to make sure that you can actually do suprapubic. A lot of times people with suprapubic catheters, because you're not dealing with that lower urinary tract, they often will say they have less infections than a urethral indwelling catheter. Just because, and especially for women, because their urethra is so short that they have less infection. And for personal reasons, for intimacy reasons, suprapubic catheters are usually a better option for some people that are in a relationship. So those types of things are important. So lots of different things will help the decision making. I have a client who is chosen suprapubic catheter just based on the fact that she's really an active person. She's outside the house all the time, and she just didn't want to, like Steve said, every 4 hours you got to find somebody to, you know, do the catheter for you. So all of those things are super important to look at when you're trying to decide on that surgery.
Mm-hmm.
There was a question about Botox, right? So Lynn, you had a question about Botox. So Botox is used more and more for the bladder. It's an injection right into the bladder muscle. And it's to help relax the bladder so that it can hold more urine. Okay, so a lot of times people experience less leaking. Maybe they can go longer in between doing their catheter. So it's usually, the bladder is made up of smooth muscle, so the injection usually lasts longer. Usually every 6 to 9 months in there they would get injections, because the medication does wear off. But it has shown quite a bit of success in treating the bladder. You don't get those other systemic kind of side effects that you might get taking an oral medication that helps to relax the bladder. So dry mouth, constipation, things like that maybe aren't a side effect because the Botox is delivered directly to the muscle. Is that what you meant, Botox for the bladder?
Mm-hmm.
Yeah.
It doesn't work for everybody, so just keep that in the back of your mind. But they're seeing a lot of success with it, and the first time you get it, it might not be an answer to your prayers. You might have to do it again. And it isn't a cheap process if you have to pay for it.
Mm-hmm.
I know that we have a few people that have phoned in, actually, and I should get to them, but Irene did send me an email and wanted to know what the magic bullet was. And on that, I had a question on suppositories about the new latest one, the CO2 one, or And if anyone has any, I don't know how it works.
It's an American.
Yeah, that's the problem, right?
Bonnie and I can maybe do some research offline and share it with you, Terry. I honestly, I don't know how it works, other than it's not a water-based or it's not an oil-based suppository. It isn't Health Canada approved, so I don't know anything about it. But we will. Bonnie's got it written down in her little notebook. Find out.
The difficult thing when there's things that are used in other, countries, if they're not approved in Canada, we kind of don't have a lot of information about them, or we certainly don't have best practices with regards to using things that aren't available in Canada. So a lot of it is kind of doing your own research and stuff like that, right? Yeah.
If you can answer the original one.
Do you want
magic?
Yeah.
Basically, the magic bullet is it's a dull collapse suppository. It's just prepared differently. It's water based rather than in a vegetable oil, so it acts more quickly. It melts more quickly in the rectum, so that it sort of gets the bowel routine going. So for people who are having long bowel routines, a lot of them switch to the magic bullet, and it's once the medication is absorbed, it starts to irritate those nerves in the rectum and starts the contractions to let go of the stool. So for some people, it works really well because it can speed up their routine, but it is more expensive than the dull collapse suppository. So that's kind of the difference.
It is a little more expensive. It's same medication. Some people complain of cramping when they use it, that it's too powerful.
So you can cut it in half.
You can cut it in half. I stopped using it because of the abdominal pain afterwards. Depending on your routine, how you put the bullet in as well, you just want to be cognizant if you are trying a magic bullet, that you want to be over the toilet fairly fast.
Yeah, it works within 10 minutes. It starts getting things going. So it's pretty strong. So I know a lot of people will cut the suppository in half. And so those are all things that you can trial. Steve sells them in eaches. They do come in a big box and they're expensive. So if it's something you want to try 2 or 3 times, you could always order them through him and just see how well it works for you. The shelf life of it isn't as long as a normal dull collapse suppository, so you might not find it in just your pharmacy around close to home. They don't generally keep them on the shelf just because they don't have a long shelf life as compared to the other suppository.
Mm-hmm. There's definitely some comments there, and maybe we can get them there. Bonnie, I think you have to leave pretty soon, if not now. So there are, the specific ones for you. Hubert sent in a question. Might there be long-term consequences from using an enema bulb filled with sterilized warm water to induce a bowel movement every other day?
Well, if you're just using water, anything you're putting into your rectum, there's risk for tearing the lining or something like that. So I think as long as you don't have any contraindications of why you shouldn't be using something like that, there is an anal irrigation system called Chairstuff that does introduce a catheter into your rectum, and it's held there by an inflated balloon during the delivery of you pumping in water. So That's been used in Europe for many, many years. It's been in Canada since about 2010. It comes with quite a cost. So again, that, you know, people have to weigh out, is it covered by their insurer? And that's often a big factor of whether they even try it or not. But I mean, there's lots of people that use irrigation to sort of help with their bowel management, and lots of times just using warm water. You would want to make sure that the water's not too warm, because the lining of the bowel is pretty sensitive. So, you know, when you're using something like Chairsteam, which does just use water, you want to have it at room temperature. If the water's too cold, you could have a lot of spasms and pain. And so if this is sort of a home remedy, homemade type of thing, again, I would just caution, you know, how far you're introducing what's delivering the water, and making sure you've got no contraindications like recent surgeries or hemorrhoids, anything like that that might complicate that delivery system.
Jenny, I agree with you. None of bladder and bowel products should be all paid for, but
Yeah.
fortunately.
So then just two really quick questions there that I think you can answer. How much normally is the Botox injection? And then about the Duet Foley.
I'll answer the Botox, and then I apologize, I'm gonna have to go. I have a patient waiting, but you know, Botox is it's in 100 unit vial, and it's just a powder that they reconstitute with saline. It's you know, they might deliver a maximum, I think it is, of 200 units into the bladder. Whether they would start with that depends on your urologist. It's probably about $400 the last I heard for one vial. So 100 units might be about $400. A lot of times people are covered under special authority for that. So that would be the doctor writing a special authority so that it can be covered. But that would be reviewed with your urologist.
Thank you, Bonnie.
And
Okay,
the Duet, sorry,
Yeah.
say goodbye.
Bonnie,
Bye, everybody.
if anyone has any questions, is it okay for me to ask you and respond if anyone has?
Sure. Yeah, and if there's questions, there's many, you can just put it all in one email, and I'll try to get to when I can send it back to you.
Okay.
I am away the month of May, so you know, it might be after that. But
Great. Thank you so much.
good to see so many people online. This was fun.
Thank
I keep
you.
waving at Tom because I know him.
All right.
The Duet Foley is not available in Canada yet. So I cannot comment on the pricing. I believe it's in Health Canada's hands. So if it does come up, I will have it sent out via SCI social media, because there are a lot of people that are interested in it. Sorry, that's the best I can do.
How does it work? Do you have, information on like what it is?
And the current Foleys that we know today have one balloon. And what the Duet and what the selling feature or what the feature is on the Duet is there's two balloons. The one balloon, it's always got, I don't know, an inch that is wiggling around and touching the bladder and causing irritation. Sorry, I'm not medical. That's why I really wanted Bonnie here. And it's creating mucus, where the Duet has got two balloons, one at the neck of the bladder and then one inside the bladder, so that nothing's wiggling around, creating irritation, mucus, whatever. So that's really the difference in claim.
Okay, awesome. I think there's some people that wanted to have some comments, but first I want to make sure that the people by phone, because they can't type anything in. So if anyone can hear me who's on the number 604-299, if you have anything to say, 604-299.
Oh, that was me, Terry.
Oh, is that Irene?
Irene, hi.
Hi, Irene.
Hi, you've dealt with my issues, so that's fine. Thank you.
Thank you. Okay. We'll go to the next one, which is 604-437. 437. Do you have any comments there? Hello?
Hi, Eugene here.
Hi, Eugene.
Well, very good meeting. I was just listening along and taking notes. Thank you very much for doing this.
Awesome. Any questions or comments?
No, my questions were all answered.
Awesome. Great. Okay. Then the next one, 604-526.
That's me, Terry. It's Linda McGowan.
Hi, Linda.
Hi. I only had one comment, and I know Bonnie's left, but I know she said that when you have a UTI that you need to take the specimen in before you get your antibiotics. But as you probably know, I'm not SCI, I'm MS, and I've had MS like 35 years. And when I get a UTI, I get delirium within 12 hours. I mean, I'm unconscious. I can't talk. I can't remember. I can't believe the next day people say, don't you remember having a shower? I don't remember anything. So my GP leaves me with an antibiotic to use whenever I suspect I have UTI, and then take the specimen in. Because within 24 hours, I'm in the hospital.
Yeah.
Sorry,
so that's a little bit unusual.
Yeah, sorry, I didn't get your name there.
Oh, Linda.
Hi, Linda.
Hi.
And that is severe. But again, maybe I shouldn't comment on it, but Bonnie's bring the sample in and wait for the results before you start antibiotics.
Yeah, I keep CNS bottles in my fridge, and so when I suspect, I take a specimen before I start the antibiotics.
Right.
And take it in. But if I wait for the specimen to come back in 48 hours, by then I'm in the hospital in ICU.
Right, and I would recommend that even for the spinal cord population, is that if you do suspect a UTI, you can have a macrobid or something that will make you feel better within 24 hours. But take the sample first.
Take the sample first, yeah.
And then start the antibiotics. And then watch for a result in 48 hours. And make sure.
And the labs.
If the
I say the labs are quite willing to I keep 2 or 3 CNS containers in my fridge.
Right.
So I always have one.
And the comment, I forget who it was. I think it was Lynn. I don't see you still on, but that the weekend the Life Labs is closed. You can take a sample and put it in your fridge and take it the next day.
Yep.
But you do have to tell them that it's been in your fridge for a day or 2.
And the other thing you can do, Steve, is that I have a standing order, a 1-year standing order at the lab, so I don't have to get a requisition from my doctor every time.
Well done.
I can just take the specimen in and they'll accept it. Because if you don't have a requisition, they won't even take the specimen without it.
Good job.
Thank you, Linda. And then I know Kim had a few. I wonder if Kim, you want to Kim?
Most people I thought might get a little annoyed.
Oh, I think she's talking to someone else. Kim? Oh.
And it was pretty funny too.
I'm going to move on to Janine. I know you had a couple little comments there. Did you want to say them in person?
No.
You're good.
I agree with you though, Janine. You shouldn't be paying.
I agree too.
Yeah, it's not fair.
Yeah, exactly. And let's see, Angie, I know you were talking about the duet. Do you have any other comments or anything?
No, it was just, yeah, I'd heard a bit about the duet, and I wondered if anybody else had any experience with it, or, well, and that was a good update from Steve that it's not available yet, and that I guess a number of us are anxiously awaiting to hear about that.
Mm-hmm.
I do have a customer, and if you're wanting to talk to somebody using it, he's got a sister in the States, and so his sister buys the product and sends it up to him.
Yeah, Steve, if you have a way of putting us in touch, that'd be great.
I will ask the question if he's willing to talk to you, and if he is, then I'll put you two together.
Okay, thank you.
And Roger, I thought, had a very, where's Roger? Interesting comment there that you get your suppositories made for you, which is interesting. So do you want to talk a little bit more about that, Roger?
Yeah, well, before the Magic Bullet came out, I had already decided I wanted something that was water-based. So I did some research and came up with a formula and provided that to McDonald's Prescriptions, which was the only ones that were doing the compounding at that time. I don't know about now. And then we got the folks from Magic Bullet gave me what they were using in theirs, and we basically created the same thing. So, you know, for the last 15, 20 years, I just get them made up, and they'll mail them out to you. You know, I don't want to compete against someone else here that sells products, but you know, if you're having trouble and you wanted to get you know, the same product, you can actually just get it made. And my insurance company pays. I think I mentioned earlier that recently they've just asked for what are the ingredients, and I just got the lab to provide that information to them, so they're still paying for it under my insurance. And I've done that through 3 different companies, so it's not been a problem to get it funded over the years. So yeah.
Interesting. And could you potentially have, like if the Magic Bullet works really great for you, but you are, you know, I experience pain also, maybe they could remake it with less of a certain.
Yeah, I'm not a scientist or anything.
Me neither. I don't know.
I gave them all the technical information originally. I for about 30 years I've been making my own suppositories. But you know, I came to BC and then I went to them and got them to do it. And then I knew the guys at the Magic Bullet originally, so they were okay to give me this information to make sure that I was doing the same.
Right.
And so it's been working for me. So I've not had any reason to have to change anything. But I'm sure if you knew, you know, I would have been reluctant to do a different formula because I don't have that knowledge. So, you know, I was comfortable with, here's what it is, here's what I want, make it for me, which is what they continue to do.
Right.
And I know they're doing it for many other people at SCI right now. They've been doing for the last 10 or so years. So, but anyway, it works for me. But like people have said, everybody's different. So, you know, that's about all I know.
Yeah. Awesome. All right. Thanks. Now, let's see if Orlando, I'm going to unmute you and see if your question had been answered about the Botox there. Orlando? If you're there, you should be able to say something, but maybe not. Orlando?
Yes.
Oh, did your question about the Botox?
Yes, correct. Yeah.
You're okay?
Yeah. Thank you so much.
I'm going to try Kim again. Kim.
Hi there. Can you hear me?
Yes.
I guess you can't see me, can you?
I cannot see you. You're black right now.
Well, I will try to log in again after my question. But the question, no, I've come off again. The question I have is I do intermittent catheters, and as a lifestyle choice, everyone says drink, 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 which is easy for everyone to say, but not always practical. When we're going out, there isn't often a wheelchair washroom. The other consideration is, as we age, I've talked to people about how they often change their form of bladder management as they age. One of my concerns is with increased transfers, there's increased chance of overuse injuries, developing carpal tunnel and that. Just wondering if anybody has any experiences to what's happened to them as they age with a spinal cord injury, transferring, have they changed their form of bladder management? To be honest with you, getting up every 2 hours sometimes to go to the bathroom in the middle of the night is also a problem. I'm just looking at investigating other options at some point down the road.
Yeah. Does Steve, did you hear her okay?
Yeah. I think a little bit, Kim, if I don't answer this correctly, please let me know that I'm off on a different tangent. I've got lots of customers that will do a catheter in bed and use an extension hose into a night drain bag. I've got some that will do it in the urinal, leave the urinal on the dresser until they get up in the morning and go. It all really depends on your lifestyle. I've got another customer that has an overhead ceiling lift, and he's able to operate it himself, and he uses that so that he saves his shoulders. I hope that was the question you asked.
I know others were talking about suprapubic, and I think we got a lot of it, but why don't you talk a little bit about the Mitrofanoff procedure too? Can you say anything about that, Steve?
Myself?
Yeah. Or like, do you know anything about it?
The only thing I know is if I was a girl, I'd probably do it in a heartbeat. Sorry, girls. But I don't know the procedure at all, but I do know it can be reversed. It's an individual preference, but I apologize. I don't know the whole medical, what's entailed.
Right. And as far as like going, I know Kim said there that women can't go in bed as easily as men, which is true, but that's actually how I learned how to do intermittent caths. So it is possible. It's just about like proper positioning, right? So that was the only way I used to be able to do intermittent caths. And now I don't know, I can't do it anymore because I haven't done it in so long, but yeah.
We all learn one way or learn something and do it repetitively, and then it becomes easy, and it's really hard to switch back to anything.
Yeah.
I used to get dressed in my chair, and you think I could even put a sock on now in my chair. Forget it.
Yeah, exactly. Yasmin has a question there. I think I forwarded you some information about that DEHP and catheters. Were you able to find any information about that?
I contacted Bard, Roosh, Hollister, and Manfred Sauer in Germany. They've all got back to me. I have not contacted Medrex or Coloplast. Benlin, I guess, is the Medrex. The only one that's got back to me out of those ones that I've asked the question Bard's got back to me on, and one of their catheters does have the DHP,
yeah,
whatever it is, and it's a Nelaton, very inexpensive catheter. So I will, Yasmin asked the question to a couple other manufacturers. It concerns me. The Bard is in a box of 100, and they call it a Nelaton catheter. So it concerns me that the less expensive ones could have that product in it, whatever that product is.
Mm.
But I'm only going on right now. I've only found one brand type, and it happened to be a very inexpensive Nelaton catheter that they sell to the hospitals.
Right. Thank you. And then she asked, is CureCast more expensive? Are they available in Canada?
They are available in Canada, and the hydrophilic just came out, I believe, or is coming out at the end of this month. They are around, a good catheter is around $1.50. A good gel catheter is around $1.50. And they run in that range as well.
Cool. There was a comment earlier, I think it was Janine was talking about the suprapubic. And this, I think, is a good question for you, Steve, because I've heard you comment about it before. So Janine was saying that she has a suprapubic and it's great, but sometimes with infections, her bladder spasms and lots of urine shoots up and soaks me. And, you know, this may not be specific about the UTIs, but I know in education sessions at GF that you've done before, that you've talked about finding the right size of catheter for you and how important that is.
It's not always in the indwelling Foley world. The bigger is not always better. Unfortunately, smaller can add to different problems as well because of the sediment in our bladders. But if you've got a leaking problem, you can sometimes solve that with a smaller catheter instead of a larger catheter. Because if your bladder's spasming, it could be spasming because of the catheter in there, and a smaller one just doesn't irritate the system as much.
Yeah.
So bigger is not always better.
Awesome. I just want to ask a couple people who we haven't heard from yet. Maybe Norm, do you have any comments or questions?
Can you hear me?
Yes, we can hear you.
Good. I had a question about the drug that you talked about earlier that you can buy over the counter that help prevent bladder infection. Could you give me the name of that again?
Demonose, D-M-A-N-N-O-S-E.
Demonose.
Again, Norm, as long as you know that it's E. coli in your bladder, sorry, I've only got about 5 minutes left here and I gotta run, but
yeah,
as long as you know E. coli in your bladder, then the Demonose may help.
Oh, okay, so it's okay.
Yasmin, I'm going to unmute you. Hopefully we can hear you. Are you there, Yas? Yasmin? So she asked, are antibacterial catheters available in Canada?
Yes, Bard just bought Rochester Medical in the States, and so the Magic 3 is available in both female and the male length, the longer and short.
Okay. Yes.
There's I haven't seen any research on it, Yasmin, so it's a trial and error thing, and you have to make your own choice, right? But it will be more expensive than the $1.50.
Okay, Marnie, we haven't heard from you. Do you have anything? Oh, we can't hear you. Yeah. Still can't hear Marnie.
There she is.
Okay.
Yep, we can hear you.
Yes, I need this for my microphone to work for some reason. Both Jeff and I have been to an infectious disease doctor before. There's a couple different ones in Surrey, as was mentioned. To me, they didn't really have too much interesting to say. One guy wanted Jeff to take this powder. It's kind of hard to see. It's called Monorail.
Mm-hmm.
I don't know the exact. But what I do is take like macrobid 2 times a day for like a preventative thing. But basically, the doctor wanted him to take that once every. It's a powder, and typically, if you have an infection, you would take it once every 3 days, and I think it's for maybe like 3 doses or something like that. But this guy wanted him to take it once every 10 days as a preventative measure, and his doctor didn't really agree with it. His doctor doesn't really think that medication does much good, but it is something that I'm sure does work for some people. So something to keep in mind. However, Jeff recently discovered this at the health food store. It's called Pro Bladder, and it has pretty much just pumpkin, soybean, 3-leaf caper, and cranberry. But he's like, it's the best thing he's ever taken. He's like just notorious for infections one after the other. So the suggestion, what was I going to say too? So I have a friend that has a super pubic. I don't know too much about them, but he has just recently got home from GF, and none of the he has home care nurses, but none of them will touch it. Like he's get kinking and leaking, and he basically, anytime he has a problem, he has to go to emergency. So is there anything that people can do to encourage home care nurses to learn this thing? I mean, something for Bonnie, obviously, but has anyone else had that experience, I wonder?
I've never heard of because it's a Foley catheter just in a different port, so I don't understand why there should be an issue, but that is a question for Bonnie. Can you hold up that first one that the infection control doctor wanted you to take? I wanted Jeff to take. You can read it out to me. MONUROL.
Yeah. And the instructions, it says, dissolve 1 packet in half a cup of cold water, stir and drink immediately for 1 day every 10 days for 6 months. So there you go. Yeah, it was 10 days for 6 months he wanted him to do.
One thing I can say is most SCI fight bladder infections. And we're all individuals. I've got one guy that swears he puts cinnamon on his toast in the morning, and if he misses that, he gets a bladder infection. I mean,
yeah.
Go for it.
That brought up a really good point that I wanted to mention was, so Jeff had really just, ongoing UTIs, and it finally got to the point where, he was resistant to every oral antibiotic. And so the doctor, he actually had to go on that, was it like a 3-month IV, like with the PICC line and everything, right? And basically, as soon as he was done that, like the doctor's like, oh, it's going to reset your immune system. And basically, as soon as he was done that 3 months, he got an infection like within probably 10 days, right? And I know myself, I've had that where the doctor's, pulling out his hair, oh, you're resistant to everything but IV. And I didn't do anything. I maybe drank a tiny bit more water. I went back 10 days later and I was resistant to Cipro again or something. Or, I could take an oral antibiotic. So I think a lot of people, they shouldn't just jump into taking antibiotics too quickly, for sure. And also if there is, if they say you're resistant to everything but IV, don't just automatically go to IV like unless you know you're dying from it, right? But if your symptoms aren't super bad, just don't overdo it.
Mhm.
Yeah.
Thanks, Marn. Well, Steve, I think you probably have to go now, as do I. Have a little boy to go pick up. Sorry that we're like half an hour late, everybody. You probably still have tons of questions, but I really encourage you, please just contact me, send me an email with any questions that you have, and I will make sure Steve and or Bonnie get to them because they owe me 30 minutes. Ha! Right, Steve?
I apologize, everybody, but yes.
So,
Take care.
and I can connect you all as well, so no worries. Thank you all so much for coming out, and I'll also let you know when this is up on YouTube. So, yeah, if you have any questions, just let me know. Thank you.
Take care.
Bye, everybody.